I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Dr. Brandon.
Thank you, Mr. Chairman. May I trespass slightly from my brief and congratulate the panel on the production of a remarkable document. Although I don't entirely agree with the emphasis in every respect, I think you have done a remarkable job in producing a clear and authoritative document. As far as the point which Dr. Breckenridge was raised, I can assure him that none of our patients had persistent delirium during that full hearing. Many had transient delirium after treatment, but the majority showed a dramatic reduction not only in symptoms, but a marked improvement in the quality of life, with total absence of delirium through that full hearing.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on a Thymatron pulse ECT device. And in there it shows the physical characteristics. The other, and pardon me for the emotional content of it, I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. Now that's emotional, and I don't really want to bring that up. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending, what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that's almost instantaneous entering the brain. This takes a half a second. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun.
Huh?
Out with your gun.
Okay, this won't hurt. It'll be over in just a moment. Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready? Here we go.